you really need vitamin D tablets? New guidelines released by the US Endo Society for vitamin D supplements restrict use among specific groups, but this may not apply to India. The highlights of the recently held annual conference of the Endocrine Society in Boston was release of new guidelines on the role of vitamin D for the prevention of diseases. These call for limitation vitamin D supplementation beyond the daily recommended intake for specific risk groups and advice against routine 25-hydroxy vitamin D testing in healthy individuals. Can we afford to do that? Despite being near the equator, Indians have been shown to have low blood levels of 25-hydroxy due to various reasons, including sun-avoiding behavior and extreme atmospheric pollution. Let's take a look at the key takeaways for Indians. Should empiric vitamin D supplementation be used for children and adolescents age 1 to 18? For this group, the panel suggests vitamin D supplementation to prevent nutritional risks still seen in Indian and potentially lower the risk of respiratory tract infections. This include fortified foods or supplements. In a 2014 study, more than half the children in Delhi schools were shown to have vitamin D level below 1200 grams per ml. In Indian studies, a dose of 1000 per international unit per day to correct the deficiency. Confined urban settings, should supplementation be used by adults over 75 years? For the general population in this age group, the panel suggests supplementation because of its potential to lower the risk of mortality. This is regardless of the baseline D levels. Daily doses in the range of 900 to 1000 units per day have been recommended. This age group generally has a high percentage of bone disease, osteoporosis, and a low proportion of healthy people. Decisions should be taken by the physician in accordance with the disease condition. What about pregnancy? The panel recommends vitamin D supplementation during pregnancy given their potential to lower the risk of preeclampsia, intrauterine mortality, and preterm birth and neonatal mortality. This is regardless of the D level. A wide range of doses, 600 to 5000 international unit per day, has been used by researchers, and the optimal dose remains to be determined. The average daily dose in trials was 2500 international unit per day. Established opinion 2000. Fact of the matter, the current guidelines focus only on the prevention, unlike the earlier ones which included treatment. Should vitamin D supplementation be used by adults below 50 years of age? In the general healthy adult population younger than 50, the guidelines don't recommend vitamin D testing or supplementation. Adults in this age group should follow the recommendation daily allowance RDA established by the Institutes of Medicine, 600 international unit per day. Studies from India suggest that we may require greater than 1000 international unit per day because baseline level is generally lower than in the North Americans. Should vitamin D supplementation be used for adults age between 15 and 747? The panel was against routine vitamin D supplementation. However, in India, given the higher prevalence and lower age for onset, osteoporosis, fractures, and low vitamin D levels, one should consider supplementation, particularly among those with poor sunlight exposure and during winter months. In international units in pregnancy would be safe for Indians. What about vitamin D used by adults with pre-diabetics? For adults with pre-diabetics, the panel suggested supplementations to be reduce the risk of progression to full-blown diabetes in addition to lifestyle modification. A wide range of doses was used in trials. A dose of 2000 international unit daily is likely to sufficient for this effect. This is an important and new recommendation in the Indian context where the prevalence and number of people with pre-diabetes is high. 15.3%, 136 million. Should a daily lower dose vitamin D versus intermittent high dose vitamin D be used where indicated? In adults age 50 years and older who have indications for vitamin D supplementation or treatment, the panel suggests daily lower dose vitamin D. For Indians, a daily dose of 1000 to 2000 international unit per day is a good option. Thank you. So take your sunlight properly.